breast cancer, early detection, real facts, and less fear. Every October, we talk about breast cancer awareness, but today, let's make it real. National Mammography Day is not just another health reminder, it's a day that saves lives. Mammogram detects breast cancer earlier than any other method, often before a lump can even be felt. But it's not enough to know about mammograms. We need to understand the why, the how, and the what to expect. So let's go deeper, truthfully, into what mammograms really means to your health. A mammogram is a specialized low-dose X-ray that looks inside your breast tissues. It's still the most effective tool we have for early detection of breast cancer. And here's why that matters. When caught early, breast cancer is far more treatable, sometimes with less surgery, less chemotherapy, and higher survival rate. Modeling studies show that screening between ages 40 to 84 can prevent one breast cancer death for roughly every 80 women screened long term. That's one life saved for every classroom-sized group of women who take part in regular screening. Yes, mammogram, does it hurt? What to expect? Yes. Mammogram can be uncomfortable. The breast is gently compressed for a few seconds to get a clear image. Some describe it as pressure, others a brief sting. Scheduling your mammogram a week after your period, when your breasts are less tender, can make a big difference. And if it hurts too much, speak up, because technologies can adjust positioning, use slower compression, and pause when needed. Now, how do you prepare? Well, on the day of your mammogram, skip deodorant, powders, or lotions under your arms or chest, because they can show up as spots on your scan. Wear a two-piece outfit so you can remove your top easily. And remember, bring any prior mammogram images for comparison. Now, screening versus diagnostic tests. A screening mammogram is for people with no symptoms. It's your routine checkup. A diagnostic mammogram is more detailed, used when something needs closer observation, like a lump or an abnormal result. And here's where technology has advanced. 3D versus 2D mammography. 3D mammography takes multiple images from different angles, letting radiologists see the breast tissues in thin layer. This actually helps reduce a lot of false positive and is especially valuable for people with dense breast tissue. Now, when to start the screening test and how often and when to stop? Well, most experts now recommend starting annual mammogram at age 40 for those at average risk. If your risk is higher, say you carry a BRCA gene or have a strong family history or prior chest radiation, you may need to start earlier and pair mammograms with breast MRI. For most people, every 1 to 2 years is the sweet spot. Continuing screening as long as your life expectancy is 10 years or more and you would choose to treat a potential cancer. Now, how do you use the family history and men and a special population to determine how to screen or how to do diagnostic testing? First of all, you don't need a family history to justify screening. In fact, most people diagnosed with breast cancer have no family history at all. And the biggest risk factors being female and getting older. And yes, men can get breast cancer too, though it's rare. If a man develops a lump or a discharge, diagnostic mammogram or an ultrasound may be done.